The government now releasing a new COVID-19 preparedness plan, and I'm here with Dr. Peter Chin Hong for the very latest on what we can expect going forward. Are we ready for this?
I think we're ready for it. At the end of the day, we need to have the mindset that it's still around, even though the numbers are down. We still want to embrace life, and I certainly am, but we need to embrace life responsibly and keep on looking to see what's around. I think in terms of the plan, what I love about it is the idea that we're going to stockpile masks and testing, and most importantly, early treatment, because I think early treatment with Paxlovid and some of the future treatment possibilities will keep people away from the hospital in case they get infected. So I think, what we want to do is to embrace life, go to that new normal, but that new normal doesn't mean that it is like how it was in 2019 either.
You touched on this a little bit, but the testing and the needing to treat early. So there's this test to treat program. How would that work?
So in the test to treat program, if done well, you basically go to a place where you can get tested. And if you're positive, you get offered treatment, which is free immediately, because with these testing and treating strategies, time is everything. So the earlier you treat someone, the better it is in terms of preventing them from getting very sick, preventing them from getting to the hospital and using hospital resources, and most importantly, preventing suffering in that person and that family. There are probably going to be some barriers. So I think the devil is always in the details. In other words, a lot of people test at home with testing kits. If you need to have that verified, how is that going to happen? There are some drug interactions that are likely with at least with Paxlovid with some people. So you need to sort that out. But the principle is really good. And there are also going to be people who fall in between the cracks. So I think, if we try to think about these issues, it is a fabulous plan, at least on paper.
Yeah. So tell me about the majority of people would not necessarily be high risk, especially if you've been vaccinated. So say I test positive, should I even have a treatment if I don't have like any major symptoms at that point? I mean, that time is of the essence. You want to get it early, but maybe you don't need unnecessary treatment.
Exactly. So I think the treatment isn't, something that everyone should get. At some point, with a low risk person who's vaccinated, particularly if they're boosted, very low chances of going on to getting serious disease. If you treat that person, you all of a sudden alter that risk benefit calculus, because maybe they're on a medicine like Coumadin or blood thinner that might interact with that, Paxlovid. So, all of a sudden that risk benefit changes if you're going to be at low risk of getting on to serious illness. So again, the devil is in the details, and that risk benefit changes based on the population you come from and what your vaccine status is going to be. Basically, how likely is it going to be that you're going to be hospitalized? Once I figure that out, and if it's high enough, I think you're definitely going to benefit from getting these pills early on.
Okay, so we would want the pharmacists or whomever are going to be involved in this program to try to boil all that information down in a short amount of time with an individual patient. That sounds like a bit of a challenge.
Yeah, so I think counseling and education is going to be important. And again, again, with a focus on equity and cultural competence too, because you want to make sure everyone understands, but you also want to be very quick and nimble about it. So I think that is going to be the challenge. But overall, if we get more pills available, we'll have that luxury of offering as many people as possible treatment if they need it, particularly if people are unvaccinated, which I think is the highest risk group, immune compromised, elderly. They may be populations that we prioritize.
Mm-hmm. All right. Speaking of populations, what about kids? A lot of concern that if we move on, we take off our masks, we're leaving these kids, especially under the age of 5 who are unvaccinated, but leaving them in the dust. What are your thoughts on the risks for them? I mean, if you've got a kid who maybe is prone to lung issues, should you just be staying at home right now?
No, I definitely don't think people should be staying at home and not engaging with life. I think there's so many downsides to that as our numbers continue to go down. But what I advocate for is flexibility of thinking and, judging that risk and talking to people if that risk assessment is really difficult, because I know it's difficult for many people. But essentially, if the virus goes down to like where we were at Thanksgiving, or certainly at the time of the first California reopening in June of 2021, that risk of getting infected for a population, say kids that aren't traditionally going to get very, very ill, only maybe 2% of them get hospitalized, even in Omicron days, would suggest that people, allow that kid to follow whatever protocols are going on at schools.
A lot of us are feeling like superheroes these days. We have this sort of sense of immunity from the vaccines, maybe prior infections of COVID, and now everybody's taken off the masks. But there's always this little bit of trepidation because of what we saw happen last summer. How long can we expect this good phase to go on?
Well, I think the good phase will likely last for 3 to 6 months, unless there's a new variant that comes on board. But even if a new variant comes on board and you're vaccinated and boosted, it is very unlikely that you'll get very, very sick, even with a new variant, because your T cells and B cells, the immune system inside of you, have a memory, even though the outside guards, the antibodies, decline. Again, the only thing predictable about COVID is that it's unpredictable. So that's why we have to approach this new phase, or the new normal, with a sense of humility, with a sense of growth mindset, in case things change. But when the going is good, embrace life responsibly. But it isn't going away. And that's really important for everyone to realize. Keep your tests, keep your masks stocked, and know how to access early therapy if you are someone who's going to be at risk for getting very, very ill.
Okay, anything else you'd like our viewers to know or think about for perspective as we enter this new phase?
I would just add with the fact that I know this is a very tough time for everyone, including myself, because we're caught in this transition period. But, we've achieved a lot. Science has achieved a lot. And we're going to get to that good place that everyone wants to get to, because we have new tools. You just have to know that you can still use these tools, and they're going to really prevent the suffering that we want to have prevented.
All right, Dr. Peter Chin Hong, thank you so much as always for your expertise and joining us here on CBS News Bay Area.
Thank you so much.